moment, please. I'm testing. Thank you. Yes, please.
We'll call the meeting to order. Roll call.
Director Salmon?
Here.
Director DeVito? Here. Director Leach?
I'm here.
Director Prince? Here. Director Jeffries? Here. Thank you. We have quorum.
Okay, we'll start with the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Hey, Tom. Okay, we'll start out with the oath of office. Jeff.
Thank you, Bill. So before we administer the oath of office, I'd just like to talk a little bit about our oath of office. And the oath of office and swearing allegiance to the Constitution is one of the oldest traditions in our history. And first off, it started out fairly simple. Article 6 of the Constitution provides that all senators and all members of the House of Representatives and all judiciary members must take this oath of office, swearing allegiance to the Constitution. And presidents, beginning with George Washington till today, are all required to take a oath of office. And the oath was initially a fairly simple oath, and that's how it was for 75 years. But then the Civil War changed everything. Abraham Lincoln in 1861 issued a proclamation that all civilians in the executive branch were required to take an oath of office. And it was a broader oath of office than what had been done before. And in response to that, the Congress in December 1861 had a similar oath of office that required all public and appointed public officials at the federal level were required to take the oath. And this was the predecessor to the modern day oath of office, and it required not only to support the Constitution, but to support and defend the Constitution against all enemies, foreign and domestic, and to bear truth, faith, and allegiance to the Constitution, and to take the obligation freely without any mental reservation. And so today, all members of the armed services and all public officials at either the federal, state, or local level are required to take this oath. And when I was passed the bar, I was required to take the oath of office in front of a federal judge up at San Francisco. So it's now my pleasure, if you'll please, the three directors that have been elected, if you please come forward. I'll administer our solemn oath, country's oath, to you. So if you will, please raise your right hand and repeat after me. I do solemnly swear
I do solemnly swear
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies,
against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true faith and allegiance
that I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California.
and the Constitution of the State of California.
And I take this obligation freely,
I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion.
and I will well and faithfully
I will well and faithfully
discharge the duties
discharge the duties
upon which I'm about to enter.
on which I'm about to enter.
Congratulations.
Thank you.
Might be the most new members we've had on this board in
Oh, wow.
a while.
And
refreshing it is.
Thanks, Bill.
So correct.
At this point, let Jeff take over.
Well, actually, do you want to do for the nomination or do you go ahead and allow Bill to still the reigning chair?
I think I can handle the process.
Yeah,
if that's
that's
what you did.
Yeah.
Oh, I thought that's what we do.
Yeah.
So we try to make this as transparent as possible and as fair as possible. So first, I'd like to announce that nominations are open for the office of president. As more than if more than one is nominated, they're going to it'll remain open until all nominations are made. So nominations are now open for board president.
I'd like to nominate Jennifer Jeffries.
Do we have any other nominations? Okay, then nominations are closed, and I would ask for a motion and a second to nominate Director Jeffries as president.
I so move.
Let's second that.
Okay, could we get a roll call?
Director Salmon,
Aye.
Director DeVito, Director Leach.
Aye.
Director Consent. Director Jeffries.
Aye.
Thank you.
Okay, now we're gonna do the same thing for the office of vice president. So could I get any nominations for vice president?
I'd like to nominate Director Salmon.
Thank you.
Are there other nominations? Having heard none, could I get a motion and a second?
I so move.
So we'll have Jennifer as the, and Sally as the second.
And a roll call, please.
Director Jeffries.
Aye.
Director Canseco.
Aye.
Director Leach.
Aye.
Director DeVito. Aye. Director Salmon.
Aye.
Thank you.
And we'll go through the same process for the secretary nominate. Is there any nominations for the secretary to the board? Gotta have a secretary, guys.
May I comment on being secretary?
Yes, of course.
It's light duty. You're asked to sign things at certain times and get to engage with Raquel. So I'm gonna take a chance. Bill, I would like to nominate you, but I know your work schedule is a little bit wonky.
Yeah.
To come in and do a signature. How do you feel about it?
I mean, I'm not sure how often
Well, it
it
depends.
is.
We can also, it's not that difficult.
Okay.
Yeah.
Yeah, that's fine. Yeah.
Okay, I nominate you.
Okay, do we have any other nominations? Could I get a motion and a second, please?
So moved.
Okay, can I get a roll call?
Director Salmon.
Aye.
Director DeVito. Director Leach.
Aye.
Director Consent.
Aye.
Director Jeffries.
Aye.
Thank you.
And I believe the treasurer is appointed by the board president.
Correct.
Okay. So I think we're done.
Okay.
You gotta switch
No,
spots.
you're actually, seated in your zone.
I want to say a big gavel to fill, Bill, after your 2 terms and Howard previously. And I'll do my best, and I invite you to correct me on things that I'm doing wrong. Okay, the appointment of the chair, of the treasurer is my responsibility. Does it
Yep.
need to be done tonight, or can I?
No, you can do that as well as the committee assignments. Those are things that you can.
So what I would like to do is confer with each of you on your committee assignments before I see the whole panoply of things that can be done. And the treasurer's job is very involved, so I would want to talk to that person long and hard about that. So I will pass on naming the the treasurer at this time. Thank you so much. Okay, this is our annual organization meeting, and we've conducted C1, and we're moving on to C3, which is C2 and 3, which will be completed later. May I ask for a motion to approve the agenda?
I'll make that motion.
Thank
I'll
you.
second.
Thank you. Roll call.
Director Jeffries.
Aye.
Director Canseco.
Aye.
Director Leach.
Aye.
Director DeVito. Director Salmon.
Aye.
Thank you. Thank you. Do we have anybody in the public that would like to make a comment? Anybody in cyberspace?
No.
Okay,
No comment.
And
Thank
we
you.
also received nothing via email.
Very good. Item F, consent items. May I have a motion to approve the consent items, and if any board member would like to pull an item?
I move that we consent to these items.
I'll second.
Thank you.
Director Jeffries.
Aye.
Director Canseco. Aye. Director Leach.
Aye.
Director DeVito. Aye. Director Salmon.
Aye.
Thank you.
You're gonna have all the new names memorized by the
Oh,
end.
I
of the
got
night.
them.
Okay, that concludes item F. We'll move into G. Discussion of possible action items, review of the local area formation commission, LAFCO, municipal service review, MSR, site visit.
And I'll take that one.
Thank you.
We had our visit from the LAFCO consultants. We had directors Salmon and Jeffries on that visit as well. One thing that is to note is that this is an MSR is done every 5 years. It's actually been a little while. We're sitting at
10 years.
we're sitting at 10 years right now. 9.5.
Yeah, it'll be 10.
In a minute. Since the last one. The last MSR, the district was in the process of doing the final closure of the hospital, and the district had not outlined its priorities for growth at that time. So this MSR is going to be taking a little bit different viewpoint. The consultants from LAFCO this time are also taking a very different tack to how MSRs are being done. They're looking from a more county-wide instead of a hyper specific focus. So part of the conversation we had with the LAFCO representatives were really how could healthcare throughout the county, as well as among the 4 districts, be better collaborated, right? How could there be better cooperation among both public and private entities? How could there be a more integrated conversation? Obviously, the Fallbrook district is more similar to the Grossmont district in that we do not operate hospitals. While the Grossmont Hospital is operated by Sharp, it is still technically owned, if you will, by Grossmont. But Grossmont and Fallbrook spend a lot more of their focus and their strategic initiatives on community public health initiatives, disease prevention, health education. So the other 2 districts are Palomar and Tri-City, which operate their hospitals and have a very different focus from us. So LAFCO will have quite a unique job to figure out how to define not only how the 4 districts could better work together, but how we could also then integrate better with a Sharp, a Scripps, a Kaiser, something of that nature, let alone our various federally qualified health centers. So in Fallbrook, we have the Fallbrook Family Health Center, which is a federally qualified health center. We also have Vista Community Clinic, which has a small footprint, especially for pediatrics here in Fallbrook. Neighborhood Healthcare has helped us with a few different projects. So there are a number of entities at play, and LAFCO will be doing a review with all of them. That said, they did start their first site visit with us because we're the coolest. We were able to discuss with them what our initiatives have been over the last 10 years, the growth of the Community Health and Wellness Center, our first full solid year of programming, the introduction of our lifestyle change programs, especially the diabetes prevention programming. So we were really able to demonstrate the district, Fallbrook's district role as a important provider of health services and community health to our community. So our role and our relevance, which is often what's discussed with our MSR, is very clear. We were able to outline a great number of things. The LAFCO representatives will bring back a report. It will probably still be a year away. That may be optimistic, but still a year away from being provided. But when that is provided, the district will be provided a draft to review and comment on before it is made public. So this was just a first in a long process, but we had a very good site visit. Jennifer, Howard, do you have anything that you would like to comment on from those?
I thought they asked really great questions and you had great answers. But they were very professional, they were well qualified. So I'm optimistic that they'll come up with a report for the county that makes sense.
Good.
I would concur with that, and I would also say, sometimes MSRs have this foreboding, ghost-like features, and are they coming to eat us up or what? And I felt that it, both from staff that were there and the consultants, I thought they were very collaborative and very interested and had deep knowledge about how different federal funding programs can come into play with these kinds of things. So I'm looking forward to it.
Yeah, I would just say that for the new directors, if you, I'm sure it's in your orientation materials.
You'll find it in the portal.
it takes a little bit, but they have an executive summary of the last municipal review, so you get a kind of flavor for the reviews of the healthcare districts. And the other thing is LAFCO's getting more experience, but they're not very experienced in healthcare districts. So they just don't know when they do these reviews how to get their arms around them. And this year is going to be a particularly challenging year with the challenges both at Patton and Tri-City. And so it should be an interesting, we're looking forward to it. But you guys, you have a great story to tell here, and I think it'll be very positive.
Hey,
And we'll continue to spell out all the acronyms for quite a while, so that eventually LAFCO, MSR, CSDA, ACHC,
alphabets.
whatever,
SDR.
you'll eventually learn them. So if during a meeting, we throw out an acronym, please don't hesitate to remind us, what does that stand for? It's a good test for us. And we definitely want to make sure that we're not just jargoning you to death. So thank you.
Indeed. Thank you. On to item H, board member comments and items for subsequent meetings. We have a website event calendar that is readily available to all of us. Coming up is our planning retreat on December 14th from 9:30 to 12. And I notice you're giving us a peek at, here's our peek at our content.
Yeah, again,
One pager, I like
this is
that.
the condensed version of the strategic plan. That's mostly for the benefit of the new board members, but for our other board members as well. If you haven't been sitting in on strategic planning, maybe a while since you've looked at this, we'll be obviously going over this and just talking about some of the strategic initiatives that are upcoming, so that if and when decision times come up, you're a little more educated as to what it's all. So.
Okay, thank you so much. Our facilities and strategic planning committees will be meeting in December, and we'll remember that the offices are closed 24th, 25th, and January 1. Do board members have a comment before we move on? Comments? Yes.
I would just say congratulations to the new board members. Welcome aboard, and congratulations to Director Jeffries. I think you'll do an amazing job.
Well, you've broken trail for us, Bill.
Appreciate it.
Yeah, really.
Yeah, just a comment, as you know, it's been a couple of years since I've been a part of the board. And I think this team, and led by Bill and Rachel, in those 2 years have transformed
Yes.
the district. And so
Absolutely.
congratulations on it.
Bill did a great job helping make sure that our meeting ran smooth by helping us support the consent agenda and really allowing for more time for discussion items, which often ended up late in the meeting. So Bill, that gets to be your legacy at the very least.
At the very least, yeah.
Thank you.
Great. My comments, I wanted to comment about our new annual report that's come out and to thank everybody who gave input and also to Jasmine who masterminded this. I understand she's submitting it to a organization.
Capio, California Association of Public Information Officers.
Nice, well done, Chief.
Each year, they basically hold their own sort of contest. And as Jeff alluded to, most districts are water districts. So they have a tendency not to see as much come from health districts. So we've decided to step into their.
Well, the infographic is fantastic. Everybody can get a copy on their way out. Or did you already give them to them? I didn't know.
No,
Okay.
Well, I had a copy in my orientation.
Oh,
Yeah.
wow.
See? Okay, brilliant,
Which
brilliant.
I have to say publicly was just fabulous and really appreciated. And I feel very confident with all of the acronyms. Whatever you call it.
Yeah. All those alphabets too.
All those
Alphabets
letters.
too.
mean
Yeah, I
something
think
to
it's,
me.
yeah, spot on. I do want to say while I was signing checks, you get to know a lot when you sign the checks. I was glad to see that Jasmine, who's not here tonight, I'm sorry to say, but I know she's doing something important. She is taking the benefit that we offer our employees for tuition reimbursement for further education. Hers is going to be in global business.
Wow.
So she's going for the big view, and I was just so pleased to see that check. I think it was to Maricosta. Yeah, so that's a good sign. Everybody be thinking, you know? All right.
well, we're very pushy about educating and increasing their skills here because we get to own you while you're honing your skills, which is really
Exactly.
helpful for
Yes.
the district.
You bet. Okay, board members, any comments before we adjourn? All right, we will adjourn this meeting then.
Another record short meeting.
Yeah, wow.
Okay.